For most of us, getting into a car is entirely automatic. You open the door, step down, and you're on your way. But for a senior with limited mobility or a patient recovering from a recent surgery, that exact same vehicle acts as a dangerous obstacle course. Trying to pivot, lower, and transfer into a standard car seat introduces a severe risk of falling. This creates a frustrating gap in care. A standard rideshare cannot safely accommodate a wheelchair transfer, but since the patient is medically stable, calling a 911 ambulance is completely inappropriate and unnecessary. That gap is specifically filled by non-emergency medical transportation, or NEMT. This specialized industry exists exclusively for passengers who need accessibility support to reach healthcare destinations, but do not require emergency medical treatment along the way. Safely moving a passenger in a mobility device requires an orchestrated system of civil rights legislation, highly engineered hardware, and specialized human training. We call this specialized service ADA wheelchair transportation. The foundational blueprint for a proper wheelchair-accessible vehicle doesn't actually originate from the automotive industry. It stems directly from civil rights legislation. The Americans with Disabilities Act, the ADA, is a federal civil rights law enacted to protect vulnerable populations from discrimination. A core part of that protection is ensuring everyone has equal access to public life, services, and transportation. To enforce this access, the ADA issues strict federal standards regulated by the United States Department of Transportation. These rules dictate exactly how accessible vehicles must be manufactured and precisely how the transit services must be operated. The term ADA transportation signifies strict adherence to a rigorous, legally defined threshold for passenger safety and dignity. This 3D wireframe diagram shows structural changes required to create an accessible environment inside a standard van. Stripping away the outer hull reveals the necessary installation of slip-resistant surfaces, a flat floor structure, and expanded doorway clearances to allow safe movement. At the rear of the vehicle, the mechanical lift platform is built to strict dimensional and weight specifications. Federal standards require the lift to handle a minimum 600-pound design load, and the boarding platform must accommodate a 30 by 48-inch footprint for the mobility device. Once inside, the chair enters a dedicated securement area. The mobility device is completely locked down, typically using a heavy-duty 4-point tie-down system attached directly to the wheelchair's frame, preventing any shifting, sliding, or tipping during transit. But securing the heavy machinery of the wheelchair is entirely separate from safely restraining the human body riding in it. An independent lap and shoulder belt system must be anchored directly to the vehicle walls to protect the passenger. True physical accessibility treats the wheelchair and the human as two distinct entities, both of which must be protected simultaneously by specialized, dedicated hardware. Hardware is only as safe as the person operating it. Without a properly trained driver, advanced accessible machinery becomes a serious hazard. ADA wheelchair transportation requires technical expertise far beyond a standard driver's license. Operators must complete rigorous training covering the manual operation of complex boarding lifts, and they have to execute precise multi-point securements flawlessly every single time. Once the vehicle is moving, operators practice passenger-conscious defensive driving. Because a wheelchair user is highly sensitive to the vehicle's momentum, drivers proactively avoid sudden braking, sharp turns, or potholes to protect the passenger. That level of technical care directly extends to professional courtesy. Rushing a transfer, showing frustration, or failing to communicate a delay are clear warning signs of systemic failure within a provider's training program. The driver's ultimate responsibility involves both the mechanics of transport and the active mitigation of physical risk and emotional stress for the passenger. This precise combination of hardware and training makes reliable wheelchair transportation a vital link in the broader healthcare chain. Dependable transit ensures a patient's continuity of care remains completely unbroken. Professional transit solves daily pain points for everyone involved. Medical facilities secure punctual, safe hospital discharges, which keep schedules on track. At the same time, families are completely relieved of the physical and emotional burden of attempting risky transfers themselves. True accessibility demands rigorous safety practices, clear communication, and absolute dignity for the passenger. The physical space inside the vehicle is only the starting point. Before booking any service, you should ask a few essential questions. Verify that their vehicle lifts meet the proper dimensional requirements for your specific mobility device, and explicitly confirm that their drivers undergo specialized training in wheelchair securement. If you require a provider dedicated to transparent, compassionate, and reliable non-emergency medical transportation, visit Swift Aid Transport at swiftaidtransport.com.